After a patient is in the emergency department, some of them will go straight from here directly to the operating room.
There are many reasons a trauma patient might require surgery. One of the most common is a fracture.
In the last decade or so, there's been a very fast movement towards operative management of something like a femur fracture, where we will take the child to the operating room on the day of their injury or the day after their injury, and that's been a dramatic positive improvement. It's not just that the bone will look fine on an x-ray in a couple months, but then this child is not in a body cast. And we were looking at the child holistically, and it took a while for the orthopedic community to embrace that, but now I would say it's certainly standard of care throughout the United States.
Surgery may also be necessary for some abdominal and head injuries.
The leading cause of death for kids that die from trauma is a head injury, and so we are much better able to care for the children with the most severe head injuries, to manage the pressure in their head, to control the bleeding, and to have better outcomes.
After surgery, patients go to one of CHOP's inpatient units. Here, the expertise of the trauma nursing staff comes together with many disciplines to provide care for the child and the whole family.
How you doing, Louis? How you feeling today? I hear you going to surgery later on.
Our team is unique because we have nurse practitioners, because of the trauma attendings and fellows who specialize specifically in trauma.
What we do on a day-to-day basis is provide and guide a lot of the medical and nursing care that a child would need.
Don't hit those spikes.
Our child life specialists and various social workers and psychologists that are a part of each of the teams involved, whether it's the ED, the trauma program themselves, the ICU, they get involved very early and very deeply.
We have a great working relationship, and that's important because when I go in and I say that I'm a part of the trauma team, I reiterate that by saying the nurse that is assigned to you is the one that I'm working with who's already updated me.